Hello everyone. Today I want to share with you an assignment which I wrote on HIV and AIDS. It is an assignment on an ethical dilemma brought about by an HIV/AIDS patient refusing to let the doctor disclose his status to his wife, and how ethical theories and principles relate to the chosen case study. According to estimates by the World Health Organization, 37.9 million people were living with the human immunodeficiency virus, that's HIV, globally at the end of 2018. HIV continues to be a major global public health issue, having claimed more than 32 million lives so far. In 2018, some 1.8 million people became newly infected, and 1 million died of HIV-related causes. In June 2019, 24.5 million people were accessing anti-retroviral therapy worldwide. In 2018, there were an estimated 7,500 people living with an undiagnosed HIV infection in the United Kingdom, with 6,700 in England. Crucially, these were unaware of their infection and obviously had implications for spread. In 2018, the UK had 103,800 people living with HIV. Although retention in HIV care is high, an estimated 1,800 people living with a diagnosed HIV infection were not seen for HIV care in 2018. This shows attitudes of infected people. There's a wealthy evidence discussing confidentiality in relation to spouses not disclosing their HIV status to their partners. The following case study is one example this assignment is going to focus on. It is about an ethical dilemma brought about by a 39-year-old man called Devson, who goes to his family doctor with a dry, persistent cough, which has lasted 3 weeks and a 10-day history of night sweats. Devson is tested and found to have antibodies to HIV virus. He had been experiencing on and off opportunistic symptoms of HIV and AIDS. Devson is eventually told of his condition. And also, in the course of prolonged interviews, the risks for his wife and the distinct possibility of his children, aged 1 and 3, being left without parents should she contract the disease. Devson refuses to allow his wife to be told of his condition. The doctor finally complies to his demand for absolute confidentiality. After 1 or 2 initial illnesses which are successfully combated, he dies some 18 months later. Over the last few weeks of his life, he had changed his mind and had asked his wife to be informed of his problem. Although asymptomatic, she is tested and found to be antibody positive. Later, she goes to the doctor with a fever, dry cough, loss of appetite. Distraught on behalf of her children, she accuses the doctor of having failed her and them by letting her husband infect her when steps could have been taken to diminish the risk, yet she only known the truth. In this case study, the husband does not want his wife to be informed that he has HIV/AIDS. This only can lead to deaths. For instance, in 2018, 473 people with HIV infection died from all causes in the UK. Of great concern is the dramatic increase in the number of women being diagnosed with HIV in the UK. It is against this background that this essay has chosen a case study on HIV and AIDS and confidentiality in a way to discover if ethics, ethical theories, and ethical principles are of any help in prevention and protection of our citizens from acquiring and living with this disease, in most cases unknowingly. There are different theories to assist the doctor in making decisions. Sidhouse, 2009, states that non-normative ethics explore facts or what people do, while normative explore what people should do. The two broad categories of non-normative are descriptive and meta-ethics, while those for normative ethics are teleological and deontological. One of the sub-branches of teleological theory is utilitarianism, which this essay will focus on. Rights and justice theories fall under deontological theory and will be explored further in regards to this case study. Ethical discussions regarding whether or not medical personnel are obliged to inform parties of those infected in order to protect their well-being will be discussed. Very powerful arguments will come out of this intuition. First, a discussion of confidentiality, which will be interwoven as the essay addresses the respect for autonomous choice regarding the ethical dilemma from the doctor, patient, and the wife's perspective. Beneficence and non-maleficence will be discussed too. In regards to autonomous, beneficence, and non-maleficence, and justice, the essay will discuss how the health professionals are legally bound by them and what ought to be done. Sidhouse ethical grade will be referred to during the discussion. Argument and counter-arguments relating to this case study will be looked at. Finally, the essay will be concluded on how this case study is a dilemma. Initially, in discussing ethical dilemmas, it is benefiting to understand what ethics is all about. An ethical dilemma, therefore, might occur when a situation arises that involves a choice between equally unsatisfactory alternatives. Sidhouse 2009 identifies that ethics stands at the heart of health care and is defined as the study of human conduct, the quest to find what is right and good, and the best way to live. The best way to live faced by such dilemmas presents a challenge in making judgments. As Booker 2008 says, ethics is the making of judgments that are considered to be in the best interest of the individual. In the case study, the doctor is therefore forced to make decisions that are in the best interest of his patient. From this ethical dilemma, the doctor, Devson, who is the patient, wife, and children are the parties with an interest in the decision reached. The possible options are the doctor may inform his other patient, who is Devson's wife. Almond 2001 suggested that we might urge the doctor's prima facie duty not to neglect the welfare of his patient, of his other patient, who is Devson's wife. The doctor may be bound by the utilitarian theory and the beneficence principle to save the wife and the children's lives. By remaining quiet, the doctor is said to be causing deliberate harm to the wife who has eventually contracted this virus. This may ultimately lead to death of wife and leaving two orphans. The child who is 1 year old could have contracted the disease as there is a possibility of breastfeeding going on. These are fatal consequences that could have been avoided. On the other hand, the doctor's duty is to protect the autonomous wish of the patient, which is confidentiality. According to Dunphy, 2011, duties of confidentiality and respect for autonomy may war conflict in trying to achieve a beneficial outcome in the management of someone's exposed to sexually transmitted infection, and sexual health doctors recognize this as a genuine dilemma. The problem is Devson's wife is his patient too. She also requires to be protected. Ethical dilemma in health and social care therefore arise when a difficult problem cannot be solved in a way that will satisfy everyone who is involved. This is said by Beauchamp and Childress, 2009. Like in the case that Devson does not want wife to be informed, therefore leaving the doctor in a very difficult situation. Similarly, Allen 2012 states that ethical dilemma only occurs when two or more ethical standards apply to a situation but are in conflict with each other. Allen 2012 goes on to say health workers are faced with difficult decisions during their career, and some of these will involve ethical dilemmas or conflicts. By deciding on one course of action, the other course is harmed in some way. According to the case study, the husband, Devson, is calling for strict confidentiality, which is supported by Kanuka, 2016, when he says, duty of confidentiality is a fundamental professional obligation. Confidentiality is essential for respecting patient dignity, liberty, and autonomy, maintaining a trusting patient-doctor relationship, and protecting patients from stigma and discrimination. However, Morton 2015 states that no matter how important confidentiality is, it should not be allowed to obscure the high value of protecting human life. Morton 2015 goes on to say, there are some states in America which do permit lawyers to break a client confidence in cases where the public is to be protected from physical harm. According to Kaduka 2016, although medical professionals clearly owe a strong obligation in principle to maintain their patients' secrets, they are sometimes confronted with a conflict between maintaining their patients' confidentiality and protecting the public. Kaduka 2016 states that patients who experience situations in which keeping their own secrets may seriously impact others are urged to consider whether or not they should act based on their responsibility as citizens. In this case, the husband had a beneficent duty to avoid harm to others. If the doctor was honestly concerned with the public interest, not only would he bring himself under the rule of law, but morally and ethically look at the plight of the wife and the children. This is according to Baker 2015. According to World Health Organization 2019, once infected with HIV, a person should be considered contagious and capable of infecting others indefinitely, regardless of whether or not clinical signs of HIV disease or AIDS are present. Since the likelihood of transmitting HIV presumably increases with the frequency of sexual encounters, an uninformed current sexual partner is a likely candidate for infection if safer sex precautions, including barrier protections, are not utilized. The issue arises whether healthcare personnel should have the discretionary authority to inform a spouse of a patient's HIV status. When a partner refuses to inform a spouse of his or her HIV infection, the patient's therapist may have an ethical or legal duty to warn those partners, which may directly conflict with the traditional ethical standards and the statutes protecting confidentiality of the patient's medical records. Increased HIV vulnerability is often associated with the legal and social factors, which increases exposure to risky situations. However, recent studies disagree with the notion of not informing or warning sexual partners. World Health Organization 2019. Currently, in some states in America, a physician can be liable to a patient's family for failing to warn family members or others in proximity that the patient is a communicable disease. This is from the General Medical Council 2019. The health practitioners are obliged to explain to patients who have serious communicable diseases how they can protect others from infection. They may disclose information to a person who has close contact with a patient who has a serious communicable disease if they have reason to think that the person is at risk of infection that is likely to result in serious harm. In the UK, the dilemmas which arise involve discussion with patients about the need to inform sexual partners, and the challenge is ideally resolved by negotiation. But in the event of resistance, the doctor has an option to take the initiative, having informed the patient to communicate with the partner directly so that he or she might be given the choice of protecting him or herself against a potential lethal infection. This approach has the potential of a threat of prosecution by a partner should it become to light that the infection had been passed to them knowingly. Contrary to this view, the deontological view, according to Almond 2001, states that the practice of medicine will be guided by certain absolute rules, not to harm and not to neglect the welfare of one's patients. Almond 2001 goes on to say that faced with this unbreakable principle, the deontologically inclined physician will not disclose what he has been told in confidence. Almond 2001 further says what people deserve is irrelevant here. The doctor must act in the best interest of his patient. However, current evidence, as highlighted by Kanuka, says in Article 134 of the Japanese criminal law states that medical doctors should not disclose patient information obtained in a clinical practice without a legitimate reason, and that they will be legally punished if they violate this law. However, the Japanese Supreme Court has not specified what constitutes a legitimate reason, and it is difficult for doctors to make decisions about whether or not they should disclose patients' confidential medical information to protect others or society, solely based on this law. Almond 2001 goes on to suggest that against this, in the present case study, we might urge the doctor's prima facie duty not to neglect the welfare of his other patient, the young man's wife. Almond 2001 discusses how the husband's inaction has contributed to the wife contracting the virus. Almond goes on to say that in response to this, the doctor could both defend the absolute duty to respect confidentiality in general and claim that his clear duty was to honor his implicit vow of confidentiality, but he had the unfortunate effects which he had foreseen as possible but not intended, that it caused the other patient to contract the disease. Almond therefore concludes that one is inclined to offer an intuitive response, such as no moral duty is so binding that you can hazard another person's life in this manner. She further says AIDS has divided the community into two polarized viewpoints: civil rights versus public health. This study argues for a two-sided approach that would accept both the rights of individuals to sexual freedom and also need to protect the unaffected from infection. AIDS raises a number of ethical and social problems which must inevitably be confronted by the whole community, by people with AIDS and their relatives, and by those professionally involved. Similarly, Booker, 2008, states that one of the flaws of deontology is that sometimes an individual's duties are in conflict, and that deontology is not concerned with the welfare of others. Hence, the young man's wife was infected. From the utilitarian point of view, all ethical decisions should be based on the principle of utility, a principle that roughly translates into the idea of doing the greatest good for the greatest number. This is, however, not supported by Meher, 2013, when he says, in consideration of the ethical value of showing respect for people, an argument based on public health utility is not an appropriate justification. For instance, in the case study, Meher's viewpoint seems to support the idea of not disclosing to the wife. Burgott, 2011, concurs to the utility point of view and asserts that utilitarianism can be used to justify actions or policies that are in the interest of the majority, even when this goes against the interest of the minority. This suggested that the wife and children could have been saved. Dixon Mueller, 2007, says that one of the major arguments that critics make against routine testing and disclosure is that it may result in false accusations, stigmatization, discrimination, violence, abandonment, social exclusion, and loss of livelihood, depending on who knows and on what they believe. Like in the case that if the wife were to know, it may lead her to being suicidal. Therefore, pros and cons should be considered too, despite what the law says. Dixon Mueller, 2007, goes on to say that in her study, negative outcomes such as blame, anger, rejection, and the breakup of the relationship typically affected a small percentage of respondents. This seems to suggest that in the case study, even if the young man had disclosed to his wife, there was a possibility of their relationship being unaffected. In my opinion, it depends really with where this study was carried out. People reacted differently to situations. According to Lethard and McLaren, 2007, there's also a dilemma in that clinicians have a duty of care, which may conflict with the wishes of the patient, which is their autonomy. Seedhouse, 2009, states that autonomy is the capacity to think, decide, and act based on thought and decision, freely and independent. On the contrary, respect for autonomy is justified from the utilitarian perspective of Mill, 1982, in relation to liberty, which advocates the sovereign or self-rule of the individual over whose aspects of life that do not harm others. Seedhouse respect for autonomy highlights that benefits is for individual and the truth must be told. While creating autonomy benefits society as we ought to do most positive good things. Seedhouse respect for autonomy highlights that benefit is for individual and the truth must be told. while creating autonomy benefits society as we ought to do most positive good. According to Dunphy, 2011, duties of confidentiality and respect for autonomy may well conflict in trying to achieve a beneficial outcome in the management of someone exposed to sexually transmitted infection, and sexually healthy doctors recognize this as a genuine dilemma. Dunphy 2011 further expatiates that there is possible failure to produce a beneficent outcome in that the partner does not get pre-infection help, as is the case with the young man's wife. There is potential conflict between our beneficent desires to prevent infection from spreading with our desire to respect his autonomy through enabling informed consent, while also respecting the autonomy of the wife through protection of their confidentiality. According to the General Social Care Council 2004 Code of Conduct, the doctor needs to protect the rights of his patient, strive to establish and maintain the trust and confidence of his patient, promote the independence of his patient, while protecting him as far as possible from danger or harm. Respect the rights of his patient while seeking to ensure that their behavior does not harm themselves or other people. Uphold public trust and confidence in his job. Similarly, the World Medical Association, cited in Kaduka 2015, states that it is ethical to disclose confidential information when there is a really serious, irreversible, and imminent threat of harm to the patient or to others, and this threat can be only removed by a breach of confidentiality, which was said to be essential for respecting patient dignity, liberty, and autonomy, maintaining a trusting patient-doctor relationship, and protecting patients from discrimination. In this case, Jeffson's wife could have been saved from contracting the virus if swift action had been taken to prevent transmission. Beauchamp and Childress 2001 say that the value base of social work and social care say that autonomy is self-direction and self-rule, free from controlling interference. It is to become an author of your own destiny. According to the case study, the husband is asking for this autonomy, though at a later stage he relents on his former demands and asks his wife to be informed of his problem, which is already too late in that the wife was already infected, and the 1-year-old baby was equally put at risk of contracting the virus. This leads us to question and incorporate the principle of justice and equality. Justice is a matter of achieving harmony among the different parts of society and being determined and imposed by reason. Justice is following the law and practicing fairness in the way one deals with individuals. In this case study, the right thing to do meant following the law, regardless of whether the husband or family would be disappointed. Justice is one principle usually recognized by professional ethics. Justice embodies the notion of equality and derives the deontology of John Rawls. Canty, 2001, explains that this concept is based on the idea that whatever principles, duties, or actions are required of us must be equally required of everyone. Beauchamp and Childress, 2009, concur with Kant, 2011, in that justice refers to fairness, equality, rights, and appropriate treatment in the light of what is owed to a person. Justice is being fair or just to the wider community in terms of the consequences of an action, and this seems to agree with the utilitarianism theory, because here, if the doctor sticks to confidentiality, the family is destroyed and the community as well. Beauchamp and Childress, 2009, say non-maleficence is the obligation not to do harm to the patient or to others. This might suggest that in this case study, the doctor may be bound by this principle to save the wife and children's lives. And by remaining quiet, the doctor is said to be causing deliberate harm to the wife who has eventually contracted this virus. Similarly, the beneficence theory, which includes altruism, which is the selfless concern for the well-being of others, requires us to do good. It is said to be willingness to do things that bring advantage to others, even if it results in a disadvantage for yourself. Rema 2008 further says, beneficence also includes love and humanity and connotes acts of kindness. This route tends to benefit the patient or other. Similarly, Beauchamp and Childress 2009 says, beneficence directs us to promote the welfare of others, and it requires a good deal more than the mere respect for the individual's autonomy. In some regards, this principle insists that we assist others to realize their life plans. In the case study is the young man and his family who require assistance, failure of which has led to neglect. In conclusion, this assignment has explained what confidentiality is and how it relates to the case study. It has also addressed how the case study is an ethical dilemma by discussing the ethical theories and principles related to the case study. This assignment has provided no solution to the dilemma, but has in some way opened the eyes of its reader to the ethical, moral, and legal implications health practitioners are faced with. The failure to reach a consensus shows how the case study is a dilemma to health practitioners. In order to prevent tragedies like deaths in our case study, dying and leaving an infected spouse who is likely to die leaving orphans behind, it is important for all concerned parties to sincerely fulfill their obligations. Kadoka 2015 suggests that it may be best for everyone to act upon what is ethically best, regardless of law or social criticism. We need to establish societies in which everyone is allowed to act upon what they think is ethically best, without worrying about unnecessary societal criticism or legal charges. To achieve this, Kadoka 2015 states that community members should judge the appropriateness of concerned individuals' actions based not on the consequences of their actions, but on the processes used to decide on a course of action. The community would also benefit from a social system that makes everyone struggle less and protects interested parties. Nevertheless, it can be argued that we should continue productive discussions about how to strike a balance that protects the rights and safety of all concerned parties. I thank you.